Hi guys, today we're going to be talking about microbial diseases of humans part 1. This presentation focuses on infections of the respiratory system and skin that are caused by bacteria, viruses, and fungi. My name is Ava and I'm going to be focusing on infections of the lower respiratory system. Okay, so first I'm going to talk about bacterial infections of the lower respiratory system. The first one is pneumonia, which is caused by Streptococcus pneumoniae. This is a type of gram-positive bacterium that normally lives in our throat without causing any harm, but then when it travels down into the lungs, it can cause infection. The bacteria infect the alveoli, which are the tiny air sacs in the lungs, and then these can fill up with fluid or pus, which makes it hard to breathe. People with pneumonia usually have fever, chills, chest pain, productive cough, and then shortness of breath. Doctors can diagnose this using chest x-ray or sputum culture, and then it's usually treated with antibiotics like penicillin. People can prevent getting pneumonia by practicing good hygiene and covering the mouth when sneezing or coughing. Another important bacterial infection is acute bronchitis, which can be caused by Mycoplasma pneumoniae or Bordetella pertussis. This infection affects the bronchial tubes, which carry air into the lungs. It's usually viral, but can sometimes also be bacterial. It spreads through droplets or touching contaminated surfaces. People usually have a persistent cough, fatigue, and then chest discomfort. The best treatments are usually just rest and fluids, but then sometimes antibiotics if the bacteria are the cause. To prevent bronchitis, it's helpful to avoid smoke, air pollution, and then practicing regular hand washing. Next, we'll look at fungal infections. The first one is valley fever. This is found in dry and dusty soils in places like Arizona and California. When people breathe in the fungal spores from the soil, the infection can start, but it's not contagious. Valley fever can cause fever, coughing, chest pain, fatigue, and then skin rashes. Most people can recover on their own, but more serious cases might need antifungal medications. To prevent this, people in high-risk areas should avoid dusty environments and then wear masks when digging or during dust storms. Another fungal infection is aspergillosis, which is caused by the Aspergillus species. This is a type of mold that's found both indoors and outdoors. It's everywhere, but most healthy people don't get sick from it. But for those with asthma, lung disease, or even weakened immune systems, inhaling the spores can cause infection. Symptoms can include wheezing, fever, chest pain, and coughing, which can sometimes even have blood in it. It's treated with antifungal drugs, and then the best way to prevent this is to avoid dusty or moldy areas and wear masks when needed. Okay, lastly, I'll talk about viral infections of the lower respiratory system. One of the most common is the flu, which is caused mostly by influenza A or B viruses. These viruses can spread easily when someone coughs, sneezes, or even touches the same surfaces as someone infected. The flu usually comes on suddenly with fever, chills, sore throat, body aches, and fatigue. While most people can recover at home, it can also lead to serious complications like pneumonia, and this usually can happen in elderly populations or people with chronic illnesses. Treatment is rest, plenty of fluids, and then antiviral medications. The best prevention is getting your flu shot every year, practicing good hygiene to stop the spread of it. Another major viral infection is respiratory syncytial virus, or RSV. This virus is especially dangerous for infants and older adults. It spreads through respiratory droplets or close contact with infected people. Symptoms can include runny nose, cough, wheezing, and then just difficulty breathing. Doctors can provide oxygen, fluids, or antiviral medications in the severe cases. Prevention just includes washing hands often, covering your cough, and then avoiding contact with people who do have this. RSV is actually one of the leading causes of lung infections in babies and can require hospital care in severe cases.
Viral infections of the upper respiratory system, influenza, or the flu. This viral infection mainly affects the nose, throat, and sometimes the lungs. The cause of this is influenza viruses types A, B, and C, types A and B being the most common in seasonal outbreaks. Some symptoms include fever, chills, muscle aches, cough, sore throat, and fatigue. Since this is a viral infection, antibiotics do not work against the flu. The best treatment for influenza relies on rest and care at home, such as drinking fluids, fever and pain relief medication, such as ibuprofen, and antiviral medication may be given to patients who have higher risk complications. Respiratory syncytial virus, or RSV, is a common virus that infects the respiratory tract. It can sometimes lead to serious illnesses like bronchiolitis and pneumonia. The cause of this is a virus that infects the respiratory tract and can be spread through droplets from sneezing, coughing, or touching contaminated surfaces. Some symptoms of RSV include runny nose, cough, sneezing, fever, wheezing, and difficulty breathing. The treatment for RSV is rest at home and fluids, fever reducers. In severe cases, hospitalization may be needed for oxygen or IV fluids. Bacterial infections of the upper respiratory system. Strep throat. Streptococcus pyogenes is a group A of Streptococcus. Symptoms include sore, scratchy throat, pain when swallowing, fever, red tonsils, swollen lymph nodes in the neck, and occasionally headache or rash. Treatment of strep throat is treated with antibiotics, usually penicillin or amoxicillin. Rest and supportive care is also a treatment with strep throat. Bacterial sinusitis mostly occurs when Streptococcus pneumonia or Haemophilus infect inflamed or blocks the sinus passages and has ear pressure or pain. Some symptoms include facial pain/pressure, thick yellow or green nasal discharge, nasal congestion, decreased sense of smell, and sometimes a fever. Treatment of this includes rest. Antibiotics are prescribed if infection is suspected or symptoms are severe. Decongestants and saline nasal rinses may help relieve symptoms.
Hi, my name's Alejandra, and I'm doing the skin diseases caused by bacteria. A bacterial skin infection can occur when bacteria enters the skin through cuts, scratches, or other openings. A variety of bacteria can cause skin infections. It's most commonly in Streptococcus and Staphylococcus. And you're more likely to get a skin infection if you have poor circulation, diabetes, if you're older or malnourished, and also if you have an immune system disease such as HIVs and a weakened immune system because of things like chemotherapy or other medications. Depending on what type of skin infection you have and how serious it is, antibiotics can be prescribed, or you can be prescribed oral medication, IV medication given to you at your doctor's office or hospital directly. And you can also get ointments or creams and eye drops. If you're prescribed antibiotics for a bacterial infection, you'll usually have to take them for a week or two. You'll probably feel better sooner, but it's important to take all of your medication as prescribed, or you might not get rid of the bacteria. And some skin diseases that are a little more common are boils, sores, and wound infections. Some ways to prevent skin diseases caused by bacteria are vaccinations, practicing good hygiene. This includes maintaining a good hand washing habit, wearing clean and dry clothes, and not sharing any personal items like towels, razors, clothing. It's also important to keep your wounds clean because breaks in your skin allow bacteria to get in. Clean them and cover them and take good care of them so that you won't have any issues with that. Protecting yourself from bug bites is also very important, so wear protective clothing, use bug spray, and check yourself and your pets for ticks after being outdoors. All of this will prevent the spread of infection to other parts of your body and to other people.
Known as mycosis, a fungal infection occurs when fungus grows on the skin surface after coming into contact. Fungal infection diseases include athlete's foot or tinea pedis, jock itch or tinea cruris, and ringworm or dermaphytosis. Risk factors for fungal skin diseases include direct contact with infected person, animal, or item, borrowing clothes and shoes, sweating a lot, weakened immune system, and non-breathable or tight-fitting shoes. Fungal skin diseases should be treated with an antifungal medication, often either topicals such as ointments, lotion, shampoos, and powders, oral such as tablets, capsules, and rinses, or intravenous or IV.
One skin disease caused by a virus is herpes simplex virus. Viral skin infections as a whole occur when viruses invade skin cells, causing lesions, rashes, or blisters. Among these, HSV, or herpes simplex virus, is one of the most common and persistent viral skin infections. This causative agent comes from the herpes viridae family and has two forms: HSV1, which primarily causes oral and facial lesions, also more commonly known as cold sores, or HSV2, which primarily affects the genital regions. The pathophysiology behind this viral skin disease is that when the virus enters the body through breaks in the skin or mucous membrane, it causes the initial infection, which means HSV will travel to the sensory nerve ganglia where it becomes latent or inactive. When reactivation occurs due to stress, fever, sunlight, or immune suppression, it'll lead to reoccurring outbreaks. These symptoms include powerful grouped blisters on a red base, often around the mouth or genitals, as well as burning, tingling, or itching before the lesions appear. Lesions crust and heal within 1 to 2 weeks, but the virus remains in the body for life. The diagnosis comes from the clinical appearance of lesions as well as laboratory tests, which include a viral culture, a PCR, or direct fluorescent antibody testing. Treatment and management includes antiviral medications, and they reduce the severity and frequency of the outbreaks. You can also avoid triggers such as stress or UV light. However, there is no cure. You can focus on symptom control and preventing transmission. Prevention can include avoiding direct contact during your outbreaks, as well as using a barrier protection. Awareness and early antiviral therapy will reduce the viral spread.
Hi guys, my name is Heina, and I was in charge of the Christian worldview and application. So the Bible verse that I decided to go with was Colossians 3:23, which says, "And whatever you do, do it heartily as the Lord and not to men." So this verse I wanted to apply towards like actual healthcare work, and what would it be like working honestly in any setting that you're working with people, even if you don't want to relate it back to specifically healthcare. But the reason I chose healthcare is because I am a nursing major. So with this verse, honestly just talking about being compassionate and being able to care for people and respect for life in the practice of medicine, like I mentioned, and then working to serve others to promote healing and reflect on Christ's love. And that's it. Thank you guys. Hope you enjoyed our presentation.